rise for the invocation.
Let us pray. Dear Heavenly Father, we thank you for bringing us together here tonight. We ask for your continued guidance and protection on our citizens and our staff as we continue to be aware of the COVID-19 situation. We ask that you just guide us to be wise and safe at this time. We ask you now to lead us to wise decisions in the glory of your name. In Jesus Christ we pray. Amen.
Thank you, Mrs. Long. Opening board comments, Mr. Forehand.
I don't have any comments this time.
All right, thank you. Mr. Black?
Yeah, I have a few. I just wanted to say happy belated Memorial Day to everyone. Sorry I was unable to attend the ceremony. I saw it on YouTube. Looked like it was a very, very nice ceremony. It's amazing when you stop and think about what these soldiers and so forth have done throughout our history for the country. And for me personally, I would do anything to be able to talk to my two grandfathers who were World War II veterans again and just sit down with them and talk about their experience. I do also want to congratulate the graduates from Caroline High School, the 2020 graduates. I had told Dr. Calveric I would be there on Thursday. I have some personal business that I have to take care of up in Maine, so I will be unable to attend. Mr. Cully, if you could just remind Dr. Calveric that I will be unable to attend for that reason. The other thing too is I know Mr. Thomas, the third thing I'd like to say, I know Mr. Thomas and Mr. Seeley have been working hard on getting broadband into the county. In the GWRC meetings, Ms. Long has been attending with me. Other supervisors from the different counties surrounding us are also in the same boat we are. So I was kind of thinking that if we took a regional approach to it and maybe asked Mr. Cully when you have your county administrators meetings, if there was a way that Mr. Seeley or Mr. Thomas or someone from this board could talk to some of those supervisors and see what's going on in different counties. So maybe a regional approach to broadband. Anytime you have a regional approach, maybe what they're doing in Stafford would help us, so forth. And I really think we need to push that at the GWRC level. So kind of doing what we're doing at the local level and combine it to the regional level, because it's going to be very, very important. I think this COVID-19 situation has exposed some of the problems that some of our students still have in rural areas. Mr. Cully, also, if you could email Dr. Calveric. I did put in a phone call to her today. I know she's busy with graduation. We can talk about it more later in the budget, but the school savings this year from, the buses not running and not hiring substitutes, we'd just kind of like to know, now that the school year has ended, what those savings were, because there's lower electricity costs and so forth. So if we could kind of get a number from them, what those savings were. And finally, and I said this before, I know we'll be reading statements tonight from different members of the public. I have read in the newspapers, I'm sure all you have, some of the horror stories in surrounding jurisdictions, what's happening with education and education cuts. I think we're very, very fortunate here in Caroline since we don't rely heavily on the sales tax. We've had conservative budgeting that we really don't have to do that. So we're really lucky in that sense. So thank you, Mr. Chairman.
Thank you, Mr. Black. Mr. Underwood?
Thank you, Mr. Chairman. Just one or two comments really. Again, just piggyback on Mr. Black's comment regarding the graduating students of 2020, which is definitely a different graduation, but nevertheless, congratulations to them. My second comment is, as we look at the budget tonight, I'm hoping that we can look at our budget, and think about this year anticipated revenue losses as well as next year. I don't think we can afford to look at this as a single budget. due to the unknown coming after this year, how it's going to be impacted, and when we're going to come out of this economic downfall and the true impact that it's going to have on the county. We have not laid off any people nor furloughed anyone, but we're looking at possibly some changes next year. So I just want us to be mindful as we look at this budget tonight and think of this year as well as 21, 22. That's my only comment. Thank you, Mr. Chairman.
Thank you, Mr. Underwood. Mrs. Long?
Thank you, Mr. Sealy. First, I'd like to wish Mr. Black safe travel on that airplane. Glad it's you and not me. Come back safely and don't bring any visitors with you. I also want to thank Mr. Sealy for bringing a concern up to my attention concerning hunting and fishing at AP Hill. He called me, and by the next day I had a meeting set up, and the day after that with Congressman Whitman first, and then that afternoon myself were on the phone with the commander, and there'll be more to follow on that with details, but we have been told that they do plan on reopening the hunting and the fishing as soon as they feel it is safe. And we will have more information going out with that hopefully shortly. So I thank you, Mr. Sealy, for bringing that to my attention and for Congressman Whitman's reaching out and assisting with that. And then the last thing I want to do is to congratulate also our seniors as they venture out into this bold new normal, whatever that may be. I know it's different for you, and I can't imagine after years of waiting for the graduation what you all must be going through. But just think, when you're my age or even younger, Mr. Black's age, you're going to have a heck of a story to tell your family because you are the graduating class that survived this and is going to go out into this new normal. I know you're going to make us proud, because we're certainly proud of you all. So best of luck to all of you. Thank you, Mr. Chairman.
Thank you, Mrs. Long. Mr. Thomas?
Thank you, Mr. Chairman. To follow up on the comments about broadband and the regional approach, I think that's a great idea to get us maybe a little more bang for the buck. I'm not sure if I sent an email out to the board members or just the committee, but the committee did meet last week. Sometimes it runs together. It might have been the week before last. But we discussed various plans. The committee's made up of a lot of people with a lot of technical experience, which is great. But we talked about plans for expanding Atlantic broadband. We talked about Comcast, and they have a new representative for state and local. I personally got a chance to speak to him, so there may be some good things there. And we are developing some preliminary expansion plans to get broadband down to the Dawn Library. Mr. Sadler's been working on that, and Mr. Underwood has another opportunity that may help us there. Another thing is, I hope we can prepare a resolution, as we always do, for June 12th, which is Loving Day. Possibly, I believe we gave it to Mrs. Peggy Loving last year or the year before last. If we could present a resolution and maybe have this one put in the courthouse or the library, just for that. The other issue I had was we had some school roofing projects that were presented to us at the beginning of the budget cycle, and I'm not sure they're in the CIP, and I just wanted to make sure they are, because in particular, one was at Madison. With all of the renovations we've done, it would be a shame to have some of those ruined by a leaky roof. And last but not least, I'm going to add my congratulations to the seniors and the graduates, and to let them know that without a doubt, it does get better. And that's it. Thank you.
Mr. Thomas? And I have probably fairly lengthy remarks tonight, mostly centered around the county, but I want to start with the Memorial Day partnership with the VFW. And what a wonderful success that was. I want to thank Brian Farmer for coming and actually YouTube living it and actually recording that celebration so everybody could see it. We had just enough people show up to make it safe, to social distance. A lot of counties foregone that day. We actually went forward with it. Well planned, well executed. Mr. Thomas, I want to thank you for your help as well as the VFW, because this was a coordinated effort amongst many of us to make this all come off. So congratulations to all involved. It went very, very well. I want to express how proud I am of the Bowling Green business community. I've got to say that more has gone on there than most people realize. We have had some really creative business owners that have been doing virtual tours of their business, like the Classic Cottage, Carrie Wright, and the Painted Horse, Deborah Howard, have done stuff virtual online so people would know they're there and know what they're about. In the middle of this, we've had a new flower shop open in the Walgreens Shopping Center. The Fat Assault Boot Camp, Kenyon Pierce, has been holding his business outside and having people do an enormous amount of workout, social distanced in town and at various places around the county to get people out for what they're really into is exercise. And he's done a phenomenal job with that. And I just have to congratulate him. I also want to talk about the businesses that have done so much curbside. I want to start with Food Line. You know, when they started their drive-up shopping, everyone's like, I can't believe when he's going to do drive-up shopping at Food Line. And I think we've all seen that it has actually gone extremely well and was very timely for what's actually taken place. But I don't want to stop there. I want to talk about Roma's, Pino's, Los Dos Amigos, and Your Just Desserts. All those establishments have gone above and beyond to try to stay in business and serve the public, whether it be inside or curbside. I got to say, I couldn't have been prouder of the businesses that we've had. A&M Hardware Store. If they don't have it the day you walk in, they'll order it. You can pick it up next week. I don't think you can beat that for those people that don't want it or can't go to some big box store or don't want to fight the traffic, because I'm going to tell you, I've heard that Home Depot and Lowe's parking lot is crowdeder now than it was before all this took place. It is a testament to those business folks to serve the folks that live in and around the community that come in and need help. I want to talk a little bit about the regional partnership. Atlantic Broadband has at least 7 counties in this endeavor that we're looking at to actually turn in this fall. Mr. Black, I do agree that regional is the way to go, and we can talk to Stafford, Spotsylvania, King George, Fredericksburg, and see what else what else we can do. But I know that regionally, that's what Atlantic Broadband's really been working towards, is to actually try to bring a large region together so that when we go for these grants, that we have a much, much better chance. I want to piggyback on one of the other comments about our budget. As I said at my last board meeting, my goal is for us to not lose any county employees. I think we've worked hard with the staff that we've got. We have a great staff all the way around. I don't care where you work, whether it's Parks and Rec, whether it's one of the transfer sites, whether it's in community development or in building and planning. We have a great team of folks, and I don't want to see us lose anybody that we've worked hard to get. And I'm hoping that if we, as Mr. Underwood said, we can't look at just the 2019 budget, but the 2020 budget and the effect it's going to have on the county, because it's not a one budget year problem. It's going to actually bridge to, and we need to be mindful of that. I'd also remind everybody that you can now curbside vote. You can drive up, call the registrar, and they will bring you a ballot, and you can actually put it in the receiver that's actually used for ballot counting. You can do that until the 20th of June. And I encourage folks that are not ready to go out in public and vote that is an option they've got, and they've got a couple of weeks to do that. And last but not least, I do want to congratulate the seniors of the class of 2020. They are graduating in a challenging year. And I hope, as Mrs. Long said, that this helps them build character and gives them some direction and some help in moving in some places maybe they couldn't have in a normal year. But I think it is going to be something they get to talk about the rest of their lives. And with that, I'm going to close board comments and move into amendments to the agenda.
Okay.
Thomas?
Could I add an amendment to the agenda to have staff prepare a Loving Day resolution for presentation to the board at our June 9th meeting?
Absolutely.
And if we could add that to consent agenda item 3 if there are no objections.
Okay. Agenda item C. Anything else? Hearing none, I'll take a motion to adopt the agenda as amended.
So moved.
I have a motion and a second. All in favor signify by saying aye.
Aye.
Opposed? Ayes have it, motion carries. We now have an agenda. We will move to presentations and reports. From the report from the Rappahannock Area Health District, Dr. Stern, and are you the acting director or is there an acting director?
I'm actually the interim director
Okay.
since March. So I'm your local public health director and director of the Rappahannock Area Health District.
Oh, okay, thank you.
So Mr. Seeley and board members, pleased to be with you this evening. Talking to Mr. Thomas before the meeting began, we shared a little bit about our memories of Percy Ashcraft, who was just great to work with. I remember Cynthia Green, your DSS director. Both were relentless on making sure that children in Caroline County had access to dental care. At the time, there were no dentists in Planning District 16 who were accepting Medicaid children. So we worked out actually a district-wide strategy that was primarily school-based, and in Caroline County as well. You've seen the dental operatory in our health department there, now run by the Community Health Center. Prior to that, I had gotten a dental trailer, one of these old dental trailers that had some good equipment in it. We put it in a parking lot, and that's what we were going to use. And as soon as I hired a dentist, she said, "What's the possibility of us taking that equipment and putting it in the building?" I said, "Well, I'll look into that." And Percy jumped right on it. We spent, I think, $10,000 to renovate that space, install a 2-chair dental operatory, and it was wonderful. I used to run from my dentist, but children in Caroline County would come in and put their arms around her legs. That was before Elizabeth Barrett. And I'm sorry, I frankly, I can't recall her name right now off the top of my head, but it was great work. And Cynthia Green, accolades to her and to Percy in these regards. So the purpose of my presentation tonight, let's go to the next slide, is to give you an update of COVID-19, what your health department is doing to address this issue in our community, and what we can look forward to in the future. David, let's go to the next slide, please. I still see the first slide.
So do we.
There we go. Very good. So yeah, I'm going to give you a background on COVID-19, go through the current data and trends, what your health department, the Rappahannock Area Health District response has been, and give you a little look ahead. So let's go to the next slide. So in terms of background, you know, COVID-19 is a new or novel virus. That is a virus that no one in the world had ever been exposed to before. So this was red flag number one, a new virus nobody's ever been exposed to. Secondly, we learned fairly early by the Chinese experience and then Europe that this disease transmitted fairly easily, probably easier than flu, not as easy as measles, but it transmitted fairly easily. And we learned very early on that it was person-to-person transmitted disease. So those two red flags really started to cause folks to gear up. Then when we started seeing the hospitals in Italy become overwhelmed, folks around the world actually became somewhat concerned about the degree to which medical care systems would be able to handle this disease. And it's one of the reasons, probably the major reason why governors across the United States implemented such dramatic measures to mitigate the spread of disease in our communities. And I'll say, I truly believe this has worked. And there's evidence for this. How much of this was worth the cost will be told in history. But if we go back to the 1918, 1919 Spanish flu, there was a major new virus that spread across the world, by the way, without any jet airplanes. In 3 months, it was worldwide. 650,000 US citizens died from that. And that was when there were only 100 million citizens in the United States. There are, 350 million now. But 650,000 folks died. This was a really serious novel virus, the Spanish flu of 1918, 1919. There's an interesting study that showed how cities across the country responded to that, and in particular, contrast between St. Louis and Philadelphia. St. Louis, early on in the outbreak, shut the town down, and very, very early and fairly aggressively, whereas Philadelphia did not implement those policies so early, nor in an extensive manner. And the data is really remarkable. When you look at the mortality and morbidity data or the illness and death data from those two cities, as opposed to the policies they put into place, there was a substantial reduction in the epi curve in St. Louis. In addition to that, so it spread the disease out. They still had lots of disease, but it spread it out more over time. And they had a 20% reduction in mortality or deaths, death rate as compared to Philadelphia. It's pretty compelling evidence. And those of you who were around in the 1950s, remember when polio came to town. You shut down the theater, you shut down the swimming pool, you closed schools. So some of these extreme measures have been used in the past to try to prevent the spread of disease. This virus is not only new, and therefore everybody in America was susceptible, but it transmitted easily. And we've learned since that there are some other major issues in dealing with this. The asymptomatic nature of this disease, and that it can be transmitted in that manner. So, as you know, this disease is transmitted by primarily by respiratory droplets. That is, droplets that come from our mouth, which are very small. You can't see them most of the time unless you have a major sneeze. Coughing, sneezing, loud talking, singing can transmit these respiratory droplets. Millions of viruses contained in each one of those droplets of the individual who is infected. Those droplets travel through the air, and if they arrive in the mucous membrane, the nose, the mouth, the eyes of a person in close proximity, then the disease can be transmitted. And we're talking about usually folks who are within 6 feet for an extended period of time, 10 to 15 minutes. Those are the folks who are considered at risk for transmission of disease, who work, live, play together in close proximity. The other way this disease is transmitted, as you know, is through contact surfaces. Somebody with the disease wipes their mouth, has virus now in their hand, opens the door to the room. The next person coming in touches the door handle, picks up the virus on their hand, and if they get in their mucous membranes, it doesn't travel through the skin, but on mucous membranes, touching face, touching your nose, that virus can then be transmitted to that next person. After transmission, then incubation period is usually 2 to 14 days before the onset of illness. So if the virus sets in, illness will begin within 2 to 14 days. Again, much of this illness, 80%, is asymptomatic, mild or moderate disease. That disease usually lasts 7 to 14 days. And for the most part, it's, as I said, asymptomatic, mild to moderate. About 15% of these folks will have severe illness, and about 5% will have the more critical form of the disease that may put them in the hospital. You've heard about the symptoms. 60 to 80% of the folks will start with some kind of a fever, mild cough, may just think it's a cold or my allergies are kicking in. Then the other symptoms start following: loss of appetite, loss of taste, loss of smell, fever going up, maybe some diarrhea. There's a very broad range of symptoms associated with this disease now. And of course, then shortness of breath. Unfortunately, that then can progress to frank pneumonia, very severe inflammatory process in the lungs that could take one's life. We have had 14 to 16 deaths in our health district. So of the 1,354 cases thus far reported, 16 deaths. Now, I will tell you that 1,354 cases, which, by the way, for Caroline County would be 53 cases, is probably a substantial undercounting of the actual burden of disease in our community. Again, because of the asymptomatic nature of this disease and the mild form, early on, those folks weren't getting tested. Testing was very much so limited to those who were symptomatic or in a high-risk group, long-term care, symptomatic and long-term care, symptomatic and first responder, symptomatic and a medical service provider. These were the folks that were getting tested. And part of the problem early on was we had a very limited laboratory capability, both in the private sector and the public sector. And thus, it would frequently take a week to turn around these lab reports. Can you imagine being the physician in the hospital, taking care of a patient? Now you put them on a ventilator, and you're still waiting to get the laboratory report. So you're treating this patient presumptively as if they have COVID-19, but you're not real sure. It's a pretty good test, and all of that has changed now. Testing is much more accessible, and I think I've got a slide in these regards later. So as you know, though, this can be a much more severe disease for the elderly and people with underlying medical conditions. Probably has to do with how this virus interfaces with the immune system, our internal defense system. It just functions a little slower in older folks and folks who have underlying medical conditions, or maybe because of the medications people are using who have chronic medical conditions that inhibit the immune system, especially folks on cancer chemotherapy, so on and so forth. These folks are at high risk for the more severe form of the disease. But all in all, it's younger folks tend to handle it well. I don't know if you've heard, but we've had an outbreak in our department. 11 folks who tested positive for COVID-19. Started out in Stafford County. And before we knew it, one of the nurses who worked there also worked in Spotsylvania County. Ended up with a total of 11 staff who had to be isolated because of positive COVID-19. and over 16 staff who we had to then quarantine because of at-risk contact. Thank God none of those staff have had to go to the hospital. I called them all yesterday and they're doing well. It is interesting the range of symptoms that they suffered. Some of them were just miserable for days with a high fever that would not respond to antipyretic drugs. And a new symptom every day. It'd be the headache one day and the diarrhea the next day, and shortness of breath that was anxiety provoking. But none of them ended up in the hospital. And we're thankful for that. Most will be coming back to work next week. So let's go to the next slide. So it has significantly impacted our communities, as I mentioned earlier. 53 cases in Caroline County, and as of today, 1,354 cases. This is an underestimate, an undermeasurement of the burden of disease. As I mentioned earlier, about 80% of this disease is asymptomatic, mild or moderate, which means we probably have at least 5 times more disease in Caroline County than that case count. The case count is the number of positive COVID-19 tests that a provider has obtained, nasal swab, PCR test, sent to the lab, it turns positive. Those tests get reported to us and become part of our case count. And those are the ones that we focus our investigation and contact tracing around. But we've probably had 250 cases of COVID-19 in Caroline County. I know that because of the data, the research of this disease beforehand. There's an interesting study that was recently completed in LA County by the University of Southern California. They randomly selected 800 folks in that community of, I don't know, I can't remember how many million, couple million folks, several more million actually. But they randomly selected these 800 folks, so it wasn't volunteer, 800 folks that they did antibody testing on to look for evidence of infection. The antibody test, it can tell you whether you've been infected or not. It doesn't tell you whether you're still infected or whether you can be removed from isolation or whatever. But again, can't tell you whether you've been infected. They had reported in that community 7,900 cases of positive PCR tests over the time period. Yet this antibody test that they did on this random sample of the population, excuse me just one second, had a 4% positivity rate. A 4% positivity rate in that community would have noted that they did not have 7,900 cases, but more like 200,000 cases, extrapolating the sample to the population, which was 27 times the burden of disease than otherwise was recorded. We've seen similar studies around the country with a wide range, but I'll assure you there's much more disease out there than what we count in this number. And that's one of the reasons why I've been advising your first responders. It's important that you approach every patient, every citizen, as if they're COVID-19 positive, because you don't know. They may be asymptomatic, and the burden of disease is much broader in our community than just the few numbers or the people that we know. We have been reporting based on request and directive by the commissioner, every name, phone number, and address of individuals with positive COVID-19 in our localities. That comes in on a spreadsheet. It goes to our point of contact in emergency services in your county. But I told them it's not, the actual burden of disease is 5 times higher than that. So your folks ought to be putting on their PPE, working their contact matrix so that they minimize the exposure of EMS workers when on first contact with the citizen, do an assessment, call in help if needed. and at that time, PPE was very short supply, so that was difficult for first responders early on. Well, let's go on to the next slide. So this slide shows you the number of positive test results received by date. So early on, we were getting 1 or 2 cases a day. That grew to 10 cases a day, 25 cases a day by, let's see, my pictures are kind of in the way. So that grew to 35 cases a day by April, and more recently, we've been getting 40 cases a day, and today we had 105 cases reported today. 105 for the Rappahannock Area Health District, 4 in Caroline. Now, there's a little artifact there. The state information system was being upgraded, or they were doing something with it. So some of the cases from the prior days got dumped into today's report. But I can tell you that the day before, I think we had 78 cases. The day before that, I think it was 48 cases. So we're seeing a spike in the number of cases right now of COVID-19. Why is that? Is this disease truly penetrating the community that much more? Or is it because of the expansion of testing availability? I think it may be a combination of both, but especially improved access to testing. Let's go to the next slide. So when this disease first started, there were very few providers. The state lab had this remarkable restrictive limit on the number of tests they were doing, 200 tests a day in the state lab for all of Virginia. Yes, there were some private labs, some not doing such a good job, taking a week to turn around a laboratory report. That's ended now. We've got, 24 test sites in the health district now, 2 in Caroline County. There are fewer restrictions related to getting a test now. You don't have to be symptomatic necessarily. Most of the sites still, Mary Washington Hospital or Mary Washington Healthcare, Patient First, Better Med still require a physician's prescription to run a test, but not necessarily being symptomatic in order to get that test done. So there's much more testing being done. And in fact, when I looked at these numbers today, I compared to yesterday's number. There's been over 1,000 people, 1,100 folks tested in the last day as we see this spike in number of cases. So I think part of what's going on is because of the improved access to laboratory services and testing, we're actually just finding more disease out there. Much of this is asymptomatic disease. Yes, and some of it is symptomatic disease, and some are ending up in the hospital. We had 2 new hospitalizations today in the last 24 hours as well. But that's not, we're averaging, it looks like 1 or 2 hospitalizations a day, nowhere near overwhelming our hospitals. Let's go to the next slide. I think that's our next slide. Complete the story about testing. So the diagnostic tests, all these numbers I'm giving you are based on the PCR test. That is the nasal swab test, which is the gold standard. It actually collects the nucleic acid, that is the genetic material from the virus, replicates it very fast, very specific test. A positive test is pretty sure that you've got this disease. A negative test is pretty good that you don't have the disease. And then it's diagnostic. The serology test, which has been available the last, 6-8 weeks, not very good at first. There were lots of labs who were throwing out equipment and procedures early on. They were able to do that because the FDA was giving them a approval through a rapid process to get these tests out there, make them more available in the United States. There are some serological tests now that are fairly good and reputable, but it still doesn't tell you whether you're infected or not. It tells you whether you've been infected, but it doesn't tell whether you are infectious. Hope I said, yeah, make sure I said that right. It doesn't say whether you are infectious or not, because you could have a positive serological test, which means your immune system has recognized the virus, developed antibodies against that virus, but you may still be infectious. It doesn't tell you that you're not infectious, one way or the other. So we don't use the serological test. It's used for epidemiologic purposes, like they did in LA, to try to understand the prevalence of the disease. Some are using it as a test of cure, though that's not advised by the CDC, identifying folks if they can come out of isolation. We still use a symptom-based strategy for determining when somebody can come out of isolation. We do not use testing, though the CDC guidelines do provide serological testing as an alternate, but it's not a good idea. Let's go on the next slide. Okay, this is the hospitalization data. This, I think, is the most sensitive and truthful story about what's going on with COVID-19 in our community, because when somebody gets seriously ill, they're probably going to end up in the hospital. The serious nature of this disease can be so significant that you're going to need hospital-based care. So you could see we started out early in the outbreak with 1 or 2 hospitalizations a day. Then in early April, it was 4 or 5 hospitalizations a day. And we thought, oh boy, here we go, it's on its way. Fortunately, I think because of the substantial infectious disease mitigation policies that were put into place and a very aggressive work on our part to identify cases, to investigate those cases, isolate those folks, find out who their contacts are, and quarantine their contacts, we have slowed down the spread of this disease. And you can see now, we've seen this nice downward trend in hospitalizations, similar data at the state level. This is why the governor felt comfortable with introducing phase 1. And I heard today that he's actually considering phase 2 next week or the week after. I am going to watch this carefully, because as we see the number of cases continuing to rise, we're going to be watching carefully these hospitalizations. We don't want our hospital healthcare system to be overwhelmed by multiple hospitalizations. We're averaging about 30 folks in the hospital any one time in the Rappahannock area. That's our 3 hospitals, and nowhere near overwhelming our hospital bed availability or ventilator availability. And again, most of those folks are coming out of the hospital, and though their recovery is longer than those who don't have to go in the hospital, most of them are recovering. Let's go to the next slide. Hey, Dave, can we go to the next slide, please? Thank you, sir. So you heard me mention this process earlier. And this is the core of what your health department folks are doing to try to mitigate the spread, to try to stop the spread, or at least I should say, slow the spread of COVID-19. I am not convinced that we're really going to be able to box this in, because it is so widespread in our community, and because of the asymptomatic nature of this disease, it's hard to nail it down. Because this process, which we use, it's our traditional classic communicable disease management process in public health. Whether it's for tuberculosis or some kid with measles in the school, we're going to identify the case. We're going to isolate the individual with that communicable disease, do an investigation around that person to try to find out who may be at risk for transmission of disease. We then contact those contacts, discuss with them the value of quarantine, and advise them in those regards, and then continue the cycle to try to box in COVID-19 or whatever disease we're dealing with. But in this case, it's COVID-19. This is going to be very difficult with the amount of disease that we have in our community now and the widespread nature. But we started out with 4 folks on our case investigation and contact tracing team. I'm now up to 30 staff doing this. And you can imagine with an outbreak amongst your own staff, how difficult the last couple of weeks have been for my folks. We've continued to do this work. We've had a meeting this morning we learned yesterday as these cases started coming in. We had 70 new cases yesterday. It ended up being 105 in the last 24 hours. We've decided we need to start prioritizing our work, making sure we're identifying those index cases who are most likely to transmit disease to others. An individual living at home alone, not going anywhere, COVID-19 positive, I'm not going to worry too much about that person. Some of these tests are folks in the hospital who the hospital is testing to check to assure their ability to continue working, and they come up positive. Well, those folks are going to be managed well by employee health at the hospital. We're not going to do a heavy investigation on them. We're going to focus right now, and I'm talking about the next week or two, on those individuals who are most likely to spread disease in the community. We have augmented this team of health department staff with medical reserve corps staff. This has been a wonderful group of folks. We've had, I think, about 130 medical reserve corps volunteers at one time or another work with us over the last 2 months in our call center, on our investigation team, and our case contact tracing team. Many of these are the school nurses who aren't working in schools right now and are willing to come in and help. I introduced myself to one of the volunteers last week who turned out to be a physician from King George County. The Thursday, she closed her office, decided she'd come and help us out. So we put her in the call center, and she's answering the phone and answering people's questions. So we've augmented with that, and we're now trying to bring on board contractors. You may have heard the governor's big push to establish these large pool of contract folks who are available to come help us out. We expect by Friday, we'll have 3 to 6 contract staff who've been onboarded, had some training, have their equipment, and ready to go to work the end of this week. And I suspect we're going to need more if our case count continues to rise. We will continue to try to box us in. What that does is it continues to slow the spread of the disease. And I've committed to the folks at the hospital, we're going to try to keep them out of there. If we do a good job at this, we'll slow the spread of disease and minimize the surge or demand for hospital care. Next slide, please. So I wanted to tell you about some of the other strategies we put in place as your public health department to address this issue in our community. As I mentioned earlier, we set up a call center right off the bat. We're getting, in March, we were receiving about 60 calls a day. Many of those had to do with interest in getting tests from citizens and lots of providers trying to figure out how to get tests for their patients. Those calls have gone away. Folks who want to get a test pretty much are capable of getting tested now. So we have much fewer calls coming in. Many of them are just asking various questions about the nature of the disease. You know, my daughter went to the theater the other day and her friend has a cough. Do I need to be worried about that? Those kinds of questions. We stood up a public relations and communications group early on as well, recognizing that the way that we in public health talk to our patient is through the media. And that's one of the ways in which we inform the public about what's going on. So we've tried to establish that relationship with the Freelance Star and keep them informed about what's going on in the Rappahannock Area Health District. Yeah, and we've had both an internal and external communications arm, one which was looking more at partners and other target groups, long-term care centers, homeless shelters, the low-income Hispanic community, so on and so forth. We're trying to figure out ways to reach into those communities, make sure they have good information about this disease. Special projects that we've put in place include one, monitoring hospital surge capacity. One of the first things I did in March when I came on board was raise the question, what's our hospital current capacity now, beds, ventilators, ICU capacity, and do they have a plan to expand that if COVID-19 gets out of control? So we've received those plans from our local hospitals. We're tracking daily the hospital bed use, the ICU admissions, and ventilator use, and are very comfortable right now with the capacity of our hospitals to take on many more patients with COVID-19. Long-term care facilities became an interest of ours early on. You saw what happened in Henrico County. Oh my, over 40 deaths in one facility. We didn't want that happening in Rappahannock Area Health District. So we contacted all 21 long-term care facilities. The state had already sent to them a questionnaire, a fairly lengthy questionnaire that raised questions about their readiness for an event, the training of their staff, availability and knowledge, use of personal protective equipment, their understanding of infection control measures. We then took that instrument and made sure that every one of our facilities completed it, walked through it with them. We ranked all of our facilities, excuse me, to determine which of our facilities are ready and which ones may be at risk that we may need to pay more attention to. Another part of that plan included standing up what we call a task force. So think about it. You've seen this in other parts of the country where you have an outbreak in a long-term care facility. You find all these positive employees and positive residents, and the next day, the staff don't show up for work. Oh my, what do you do now? You've got still all these residents. So we wanted to be able to respond quickly in the event one of our long-term care facilities began to crash, whether that was because of lack of leadership, lack of their corporate office support, staff not showing up for work, a sudden rise in the number of cases in their facility. We wanted to be able to respond. So working with the Mary Washington Healthcare, we developed a strategy to be able to respond quickly with testing, with providing on-site advice, and that if things really get to an extreme nature, actually providing medical triage, identifying patients who needed to be isolated either in the facility or transported to the hospital. We stood up this capacity now, and we probably completed our one of the things we wanted to do is make sure they all had telemedicine capability, and we should have completed that survey by now. We've started a process of offering testing for all of our facilities. Now that testing capability has expanded in both the state and in the private sector, we're now offering testing. We've done one in King George County. It went wonderful. The National Guard, governor's asked the National Guard to develop these teams. He's got 5 teams. We had 3 of them in King George County in 2 hours. They tested 94 residents and 120 employees with military precision, I assure you. It was great. We'd already prearranged for those labs to be sent to UVA. Excuse me. One of our other state labs now that has expanded their capacity. We had most of the laboratories back in 24 hours, all of them back by Sunday. And so we were able to advise the long-term care center and talk to them about, they ended up having, I think we had found 5 more cases of that testing. We are now offering that to to a number of the other long-term care centers. I think we're going to do 1 more this week, and 2 homeless shelters, I think, this week. And we'll continue to do that till we've offered that to all the facilities, made it available. At this point, we not only have access to assistance from the National Guard, but also there are some contract laboratory services that are now available that reportedly do a turnkey. They'll bring the test kits, they bring staff, they do all the testing, they bring their own PPE, they package the tests, they take them back to their lab, run the labs, and give us back their reports. We haven't used one of them yet, but we may be using those contract labs in the future. Correctional institutes are also concerned because you have so many people in a very tight area. Infectious diseases are known to can spread rapidly through jails, other correctional facilities, and you have an ICE facility there in Caroline County. So we've done something similar with them. We've gone through this risk assessment with them to try to determine their readiness for an outbreak and ability to manage that outbreak. We've done discharge planning with Mary Washington Hospital, looking at the homeless population. Think about it. You got some homeless guy who's had COVID-19, discharged from the hospital. Where's he going to go? We wanted to make sure he was going to someplace safe, had a place to go, food to eat, but we also wanted to make sure that people around him were also safe. So we worked with the Regional Planning Commission to develop a plan so that we can track these folks coming out of the hospital, homeless and under-resourced individuals who just may not have a place to go, and make sure that they go to a safe place as we try to control for the spread of disease. Next slide, please. I think we're missing a slide. Let's go back. There's a couple of other special projects I want to mention. One is our work with the public schools to help them be ready for school opening in August, September. We have no state guidelines yet. The governor has called for his Department of Education, Department of Health to come together to develop guidelines and recommendations to our local public schools on being prepared for school opening and what do you do if you get a case of COVID-19. It's become clear to me because of the endemic nature of this virus that it's not going away. We're going to have to learn how to live with it, and that when we open schools this next school year, we are going to have children who show up who have COVID-19. Maybe not coming in the door, but in the classroom, maybe getting sick during the day. How are we going to handle that? Those of you who understand how these things work in schools know that if you get a kid with head lice, parents go, oh, you know, it can be high anxiety. You imagine a child with COVID-19 in the classroom. So one of the things Allison and I are working towards with our schools, we're quite sure that they're capable of preparing for and employing proper infection control so that you minimize any spread of disease in the schools. But I'm more concerned about parents being prepared for that. So I think it would reduce the community anxiety and fear if parents understand that the readiness of schools to open up and exactly what the schools are going to do to screen children, screen their employees as they come into school, implement social distancing in the school, minimize movement in the school, maybe providing lunch in the kids' classrooms, a number of measures that can be put into place to minimize the risk of spread in the school, so that if that kid shows up and you find out you have a child with COVID-19 in the school, You don't shut down the whole school. You don't shut down the whole school division. You do your investigation and maybe target that classroom. And so one classroom needs to be quarantined for 14 days. This is a process we're beginning to work through. We've got a one-page summary from the CDC guidelines, which raises a number of questions in these regards. No specific guidelines. We thought we ought to go ahead and get started on this process and work with our school divisions in these regards. And your school division's participating in this process. We had our first meeting today. We're going to be meeting for an hour every Tuesday afternoon now. Allison, help me out here. It seems like we're missing a slide here. The other special projects, anything else you want to mention?
Question. Dr. Stern?
May need to unmute. Yes.
Oops, sorry about that.
Oh, I didn't know who was
I know
missing.
we've also worked. Sorry about that. This is Allison. I'm the Public Information Officer for Rappahannock Area Health District, and I'm also on the line. Group homes is another group that we've also been doing some work with. So some of those smaller facilities that are congregate living, where we know that this can spread very rapidly.
Oh, and the other one is the what I call non-documented, non-citizen community, the low-income Hispanic community. Of these 105 new cases we've had in the last 24 hours, half of them were Hispanics and half of them have no English skills. So we know it's in that community already. We began a couple of weeks ago trying to identify these communities and develop a process to get information into those communities. Now you can appreciate some of these folks don't really want to talk to you because you're the government and they may not want to talk to you. Some of their employers may not want to talk to us either. This is going to be a more difficult nut to crack, but we think it's important to prevent the spread of disease. We can already know by our stats that it's gotten into this community and spreading rapidly. So we're moving forward with this project to try to get into and offer testing in those communities as well. I think that's it on the special project. Let's go to the next slide. So looking ahead, in phase one of the governor's plan to reopen, he'll be continuing to monitor the percent of positivity, number of hospitalizations, hospital bed intensive care capacity, and sustained supply of personal protective equipment. This last item, the personal protective equipment, is less an issue today. There are very few hospitals that are having any problem with that today. So it's basically really monitoring the new hospital admissions and the hospital capacity. And in our health district, we're fine right now. There's not been a hospital in Virginia that's been overwhelmed by this disease. And I think that's probably the reason why we're hearing now that the governor may go to phase two next week. Next slide. So you've heard me use the word endemic, which means the virus, COVID-19, is widespread. It's amongst us. It's in the population. And this isn't something we're going to be able to box up and just get rid of. It's going to be with us. We're going to have to learn how to live with it. We're all looking forward to a vaccine. That's probably not going to be available for another year or so. So we're going to be busy with this work, identifying cases, hopefully being able to open up our economy again and let people go to work. But people are still going to get sick. People are still going to get hospitalized, and we're still going to have some deaths from this disease. Unfortunately, that's just the way it's going to be because we cannot truly box this virus in. But we can figure out how to live with it. We can slow its spread. We know good, sound, communicable disease prevention measures. And that's these. Stay home if you're sick. This is probably the major reason why we have outbreaks. I got a little cough. I could still go to work. I'm fine. No. My secretary this morning said her allergies were kicking in. I said, what do you mean? He says, well, I don't know, I'm just feeling a little, upper respiratory kind of congestion. Oh, have you taken your temperature today? Yes, she did, because we're screening all of our employees. You need to talk to your supervisor about this, because we don't want folks who are sick in the workplace. At our office, any office, in our schools, anywhere, folks who are sick need to stay home. Even if those symptoms are subtle, that's how this disease starts. It can start very subtle. Social distancing, you've heard that. I mentioned it earlier about the 6-foot distance. Those respiratory droplets drop out fairly quickly. The further you're away, the less likely for transmission of disease. Wearing a mask to protect others. Now, this tends to be, I think, somewhat confusing. People think I don't need a mask. I'm fine. I'm not worried about this disease. Well, it's not you need to be worried about. It's other people you need to be worried about. Because if you have the asymptomatic form of this disease, guess what? You could be giving it to others. So when I go to the store, I was in Lowe's this weekend and at Cabela's, and in both places there are employees without masks on. So I ask them, where's your mask? Oh, well, it's not store policy. We don't have to wear a mask, and I'm just transmitting it to everybody anyway. Well, that's not the right attitude. When we're in the middle of an epidemic that I'm calling endemic now, it would be helpful to your customers if you put on a mask. I think the governor's starting to push us a little bit more. I think from his conference today, he's talking about employers requiring their staff to put on masks and then offering masks to customers coming in. We can slow the spread of this disease, keep the curve down, not overwhelm our healthcare system. You've heard of washing of hands. Hand sanitizer is great. I carry it in the car. I go in the store, do my business, come out. I've got hand sanitizer. Cleaning contact surfaces. We've already talked about how this disease may be transmitted on contact surfaces. Teleworking if possible, and staying home. And I think for the next several months, this is going to be a key element of our preserving life in our community, is asking the at-risk population to stay home. Let the younger folks go to work. Elderly and those who have underlying medical conditions, stay home, stay away. Next
Dr.
slide,
Stern,
please.
I know we need, in 10 minutes, I've got to go to public hearing. So I'd just like
Yes,
to
sir.
sort of wrap up here because I think everybody can read the rest of the slide. Do I have
That's
any
it.
board members with any
This is my
burning questions that they really want to ask? Because we're closing in on 7:30 rapidly. Mr. Forehand, I see your microphone on.
I just have a couple quick ones, hopefully. The antibody test that is the blood test, is that, if you get a positive from that, is that showing up as a current case? Is that part of the graph?
There's some complexity to this test. If the antibody in the test shows IgM positive, that implies that the individual may be in the acute phase of the illness, may have active disease. So those cases are being reported, yes. An antibody test that just shows IgG, another immune globulin, no, those are not counted in our numbers.
Okay, great. There's a lot of media coverage regarding Virginia being behind most all other states in testing. Is that a reality?
It certainly was a couple of weeks ago. I don't know what the current trends are. You can guess that this is part of the reason why the governor is really pushing to do more testing. Have called upon VCU, UVA, and the state lab to expand their testing capability, which now they're able to do thousands of tests a day, and have initiated contracts with, I think, at least 3 different private labs to provide testing upon request. So all those folks, as well as the National Guard, are now involved in expanding our testing capacity in Virginia.
Okay, is that something that, is there, trying to understand, I mean, I heard your answer, but I'm not understanding why a state like Virginia, with the resources that we have, would be next to last in the country regarding testing on something like this. Just seems counterintuitive to me, but maybe it's just me.
Well, you know, it was difficult for all the states. I venture to guess every state had difficulty ramping up their testing capability. Why Virginia was towards the bottom of the list, I do not know.
Okay. One of the questions I had, you already answered. Actually, two of them. One general question: how much has the HIPAA regulations changed the response to this versus the 1969 and the polio epidemic regarding the quarantining of sick individuals and the notice to people to stay away from those folks?
I don't see any impact of HIPAA regulations in these regards.
Okay. So when polio was rampant, there weren't signs in front of people's houses saying quarantine household and things like that.
Oh, in those days there were. You know, diphtheria, they would placard a house with diphtheria, stay away. We don't do that anymore. You know, this is private health information, so we don't identify to the public's access individuals with disease. I will tell you, it did surprise me a bit that the commissioner, because so many local governments wanted to know who these patients were, the commissioner allowed us then to give the names, address, and phone numbers of positive COVID-19 cases to one point of contact in local governments upon their request. And we've been doing that now for several weeks, over a month now. And the argument was for the use for EMS folks, so that they know when they approach a house, they know that somebody at that residence has COVID-19. So you heard my argument earlier. It's all over. You know, there may be 10 more people down the street who have it, and you don't know.
Right,
So
and that's a
put on your PPE and go to work.
right. My last question is the governor dodged the question about enforcement today during the press conference, and he basically put it all on the Department of Health to enforce the face mask, quote unquote, requirement. What have you all been advised regarding implementing, enforcing whatever that is, that edict?
A fair question. This took us all by surprise. We're all kind of shaking our heads. I mean, I'm up, my staff and I are up to here already with just trying to manage COVID-19, much less having an outbreak in our office. And now we're given some kind of enforcement requirement. I understand this excludes local law enforcement to participate in that. We had worked out a couple of weeks ago when phase 1 started, we had my environmental health manager and I called all 5 localities, spoke to the sheriff, code enforcement, fire chief, basically in all 5 localities, 5 different phone calls. And it was a cordial, collegial call, less than 30 minutes, that we agreed the health department would take the restaurants because those are the folks we regulate. My staff know restaurant owners. We can work with them to get them to follow the requirements of phase 1. These other businesses, we're not familiar with their regulatory framework. How do we do this? And every locality agreed that they would follow up on other businesses if they're a problem. And we all agreed This doesn't require pushing paper. It just requires a conversation with the manager or owner about what they need to do to be in compliance with phase one. I don't know what to do with this. I've been informed. I read some notes from the meeting, from the governor's presentation, but frankly, I still don't get it, exactly what we're supposed to do. But, we're going to be very limited in our ability to do that kind of enforcement. We may need to call on local governments to help out with that.
Okay, fair enough. Thank you very much, sir.
Yes, sir.
Mr. Black?
Dr. Stern, and just some real quick answers, if you could. What is the evidence that this is seasonal? In other words,
Simply by knowing how these types of viruses behave. That's all. We don't know COVID-19. We've never had a year experience with it, but we know other viruses of this type and of flu, and that they tend to cycle through seasons. That's all.
And I saw on one of the slides that you presented to us the different points of view on the antibody. So if you test positive on the antibody test, there's no guarantee. I mean, what is the data telling you right now as far as what are my chances of getting it again? Am I safe? Is there a...
Well, I'll tell you how Dr. Fauci answers this question. He would say that the antibody test positivity implies a response by the immune system, which is probably protective and maybe long-term protective. And he can say that with some confidence because of our experience with other viruses, other coronaviruses. And I think that's probably true, though scientists are inhibited of giving definitive answers because COVID-19 is brand new. So I am encouraged that the immune response begins fairly early during the disease. About 5 days into the disease, the immune system starts kicking in. And for most folks, there's a measurable antibody response, and that's probably long lasting and probably protective.
Okay. And
Quote Fauci.
my final question, and I guess I was kind of confused when this all started, and we started shutting down. How do you eventually we're going to be opening back up,
Yeah.
and how do you, the idea of the shutdown, I guess, was to flatten the curve. How do you prevent when you open back up? I mean, I don't think you're going to be able to have people wearing masks on a continuous basis for 2 years. How do you prevent another outbreak from happening again when we go back? I mean, did we just? I mean, my question is, did we just delay the inevitable? That I mean, or is that what we're doing, or are we waiting? Are we just waiting for a vaccine? I guess that's my confusion with the whole situation right now.
So we're slowing the process down. There's still going to be a lot of people who are going to get this virus over the next year or two. There's still going to be a lot of people hospitalized. There's still going to be deaths. The initial models, we're saying 1 million people will die from this disease if we don't do something. Could you imagine the sudden surge demand for hospital care, medical assistance, if we did nothing? We've been able to suppress the spread of this disease, but it's going to spread out over time. And you're right, we're going to still see substantial numbers of disease over the next year or so. But think about it, in 12 months or 18 months, we'll have a vaccine. And then we'll have this remarkable vaccine campaign. And then we'll all kind of settle down. It'll be like the flu. Nobody wants to get the flu. You stay away from people who are flu-like. People with flu are told, stay home, don't go to work. So I think we'll learn how to live with this.
Okay,
but in the meantime, we're going to watch the data, make sure as we return phase 2, phase 3, that our hospitals are not being overwhelmed. The governor has made that commitment to watch the data.
Thank you.
Yes, sir.
Mr. Underwood, Mr. Thomas, either one of you questions?
I have questions if Mr. Underwood doesn't. Or, well, in that case, he's on mute. I'll go ahead. Dr. Stern, you said there was a great deal of asymptomatic carriers.
Yes.
Do we have any data at all that could help us understand the percentage of people with the disease that are asymptomatic?
Fair
Oh, I
question.
thought that was the answer. I
Yeah.
thought that was the answer coming in.
No. Well, that was my daughter. So I don't think she has the answer. Sorry.
Okay.
Fair question. I'm trying to recollect any reports or data that I've seen in these regards. I'll have to get back to you on that. I'm sure in New York, they've been looking at both PCR tests and then following up with patients afterwards and trying to do serological as well as PCR tests for looking at the incidence of asymptomatic carriers. It's up there. I can tell you, we know the number I've been using is 80% are asymptomatic, mild or moderate disease. I don't have a number to break that out for you. I'll have to get back to you on that.
Because I think that's at the crux of my concern is we're not going to test everyone at the same time so we know who has it so we can isolate those people.
Correct.
But we do have people without any symptoms at all who have the virus and are therefore going to spread it to other people without them knowing it. So, I mean, that's
Yes, sir.
that's a serious problem with this whole thing. And I think you mentioned the case in California, which showed that 7% of the population had it without really knowing it. Was that the
Yeah,
one?
I think it's close to 4%. Yeah.
Okay.
Well, 4% had positive antibody tests.
Okay.
And you extrapolate that sample of 800 folks to the population, they would have had about 200,000 cases. And some of those folks with positive antibody tests had the disease because it was a random sample. So it included people who were obviously asymptomatic, but it also included people who'd had the disease before.
And see, that's another concern. I'm not sure we're all getting the right numbers, but in the US, we have 1.6 million cases and probably 100,000 deaths by the time we're finished here. That's like a 6% death.
Yeah.
That's a 6% death rate, and that's probably because we don't know who has it, who's transferring it to somebody else.
You got it. Yeah. The death rates are actually much, much smaller if you count all those folks who really have disease.
Right, but that's the thing. We're going to debate that because I got 1.6 million confirmed in one case, and you're saying that there are maybe 5 million people who have it because we don't know. All right, and my last question is, we've got several areas in the county that could be considered high risk in themselves, those who don't normally have access to healthcare on a regular basis. They're all over. I think they're in each person's district or maybe 4 of the 6 districts for sure. How can we go about getting those contract labs to come set up and test in a given area 1 day a week or something of that nature?
If you have some locations and maybe some partners in those locations, like a church, a grocery store, a community center that would be willing to work with us, we would certainly consider looking at that as one of our test sites. And we would then identify that, put it on the state roster. The state then ranks all of these across the Commonwealth. Because I can tell you there's lots of requests for testing across the Commonwealth. But we could start looking at that. Allison is on the call, so if you'll get back to me, Allison or I in regards to those areas that you feel are maybe in need. The other thing I've got on my to-do list is contact your community health center. Still have a community health center down there, don't you?
No.
No?
No.
Oh, never mind. I was going to say, we get the
there's a few
community health
things.
center to do testing.
Yeah, we really don't. That was the end of it. I think was shortly after you left or something like that. But that's the last question I had, and that's something I'm going to follow up with you directly to make sure we get those test sites in place.
Good. We'd be glad to hear from any of the board members about areas in which you think may be
Okay.
valuable for us to consider testing.
Thank you, sir.
Yes, sir.
Mr. Underwood?
No, I have nothing, Jeff.
All right, thank you. I just have one question, Dr. Stern, and that is, I know there are a number of people have said to me with asthma over this time that wearing a mask is not something they can do. It exacerbates it. How are those cases going to be handled in enforcement of mask wearing?
I don't know. Fair question. You know, I guess my first response ought to be, well, maybe those folks shouldn't be in the workplace anyway because they're at high risk for COVID-19 and having serious disease. They should either telework or stay home, period, if they have that bad of asthma. Enforcing mask wearing, I really don't know how we're supposed to do that.
I'm sure that's going to be the most asked question you get from here forward, because I know that's the number one question. I went to the post office today, and that was the question I was asked the most, is how will that be enforced? And I couldn't answer that question because I don't think law enforcement's going to do it. And I don't think the county has any means to do it. So it's one of those unfunded mandates that local governments all love and we don't know how to deal with. So I will leave it with that and say thank you. And if there are no further questions, I'd like to finish our appointments and our consent agenda, and then we're going to take a 10-minute break, and we should resume at around 10 till 8 for public comment. And again, thank you, Dr. Stern and Allison, for both joining us this evening.
Thank you, Dr. Stern.
I'm sorry, I just said thank you, Chairman Seeley and board members, and for the opportunity to have this conversation. Have a great evening.
Mr. Fortin, are you ready to make your appointment? Do you know?
Mr. Parkman, we are able to reach Mr. Beasley? Okay. No, then.
I'll go ahead and take a motion to reappoint Pat Wright.
So moved.
Do I have a second?
I'll second.
I have a motion and a second. Any further discussion? All in favor signify by saying aye.
Aye.
Aye. Opposed? Ayes have it, motion carried. We will carry yours over to the next board meeting. Consent agenda, approval of minutes, approval of warrants, and a loving resolution for the next board meeting.
So moved.
I have a motion, a second. Any further discussion?
Second. Aye.
I have a motion. All in favor?
Aye.
Aye.
Opposed?
Aye.
Ayes have it, motion carries. I hear no dissent. And we will take a recess until 10 to 8, where we will come back for public hearing on the proposed FY 2021 budget. the 26th May 2020, and we are now going to open the public hearing on the county administrator's proposed fiscal year 2021 budget. Public comment is now open.
You said public comment, you also said public hearing.
I'm
so
sorry,
are we
public
doing-
hearing. Thank you, Mr. Underwood. Public hearing is now open. Yeah, that might help. We're going to do those last. I see her, but I don't hear anything yet. I want to remind everybody that we are holding to the 3-minute rule tonight.
Testing 1 2 3. Testing 1 2 3.
We can hear you. Thank you.
Good evening, Chair Seeley. Before I begin my formal public hearing comments, I did want to take a brief moment to thank the Board of Supervisors for their support of the Caroline High School alternative graduation plans. Our ability to utilize a member of the county IT staff has enabled us to not only minimize expenses, but to ensure every graduate's experience is captured by photo and future video. We also would like to extend a thank you to the Caroline County Sheriff's Office for their support during the graduation week. Good evening, Chair Seeley, Vice Chair Mr. Thomas, Mr. Cully, and members of the board. I am Dr. Sarah Calveric, proud Superintendent of Caroline County Public Schools. In September of 2019, CCPS began collecting budget requests from school leaders and departments to assist the Multidisciplinary Budget Committee in identifying both mandated and critical needs for the FY21 Capital Improvement Plan and Operations Budget. Upon release of the governor's proposed budget in December, our team worked diligently to collect teacher, student, staff, parent, and community input regarding each budget priority. In early January, CCPS worked diligently to compile the feedback and outline 12 preliminary budget priorities. Each item was aligned with the Pathways 2022 strategic plan, and approximate costs for each request were identified. In early February 2020, I presented the superintendent's proposed FY21 budget outlining the critical and mandatory budget items. The following are Phase 3 of the Employee Compensation Plan, coverage for a 9.6% increase in employee health insurance, the state-mandated VRS increase for employers only, an 11-month work-based coordinator to further enhance student CTE pathways, 3E readiness, and community and business internships. An additional school counselor was also requested to align with the governor's proposed school counseling ratio, which has since been delayed. 3 classroom teachers to reduce class size, 2 in elementary school classrooms, and 1 to be in compliance with English standards of quality at the high school. A chorus teacher to ensure equity of access to choral programs that surrounding divisions have been able to provide their students. An additional regular education behavioral specialist to support students with social emotional needs at Lewis and Clark, CMS, and CHS. A communication and community relations specialist, a .4 procurement specialist, a 5th ITRT to ensure all 5 schools are outfitted with STEM and technology coaching and implementation, and a reading coach to support CMS in their continued efforts to enhance student performance. I was pleased to achieve the school board's full support of the FY21 budget, and then the following evening to present the approved school board budget to the Board of Supervisors. Since this time, much has changed. Without a crystal ball in hand, no one would have had the ability to forecast the future or to predict an international pandemic resulting in global, national, statewide, and local health and fiscal implications of such enormity. Since the FY21 budget presentation and the implementation of the governor's executive order closing schools through the end of the 1920 school year, CCPS has witnessed the governor's proposed increase of school funds decrease by approximately $525,000. Additionally, the suspension of FY20 supplemental lottery per pupil revenue has resulted in a loss of $262.963. We recognize there continues to be a number of financial unknowns which have required CCPS to reevaluate and modify the FY21 budget. This evening, you will hear from 3 additional speakers who will outline 2 remaining budget requests outside of the division's need to address VRS and health insurance. Dr. Herbert Monroe, Assistant Superintendent, will address our need for an English FTE to be compliant with standards of quality. Dr. Rollins Fells will highlight our continued desire to gather in the near future to discuss strategies supportive of the remaining budget needs. And Mrs. Deborah Holt, Director of Human Resources, will provide a compensation update. Thank you in advance for your ongoing support of Caroline County Public Schools. We look forward to working jointly to serve our students, staff, and the Caroline community. Be well.
Thank you, Dr. Calveric.
Mr. Chairman,
Mr. Underwood?
while we're waiting for the next speaker, did she say 263,000 lost in student revenue?
With the loss of the lottery funds being able to be used for students instead of
Right.
capital.
Right, that was 263, correct?
Correct, and that money now is 30% of their lottery money. It can only be used for capital projects. They
Right.
haven't lost it.
Okay,
It's been
thank you.
recategorized.
Okay, thank you. I didn't hear it clearly.
Good evening. My name is Deborah Holt, and I live at 106 Lacey Lane in Bowling Green. Good evening, Chairman Seeley, Vice Chair, Mr. Thomas, and members of the board. I currently serve as the Director of Human Resources and Communications for Caroline County Public Schools. As we all navigate the COVID-19 pandemic, we recognize the resulting financial hurdles schools and local governments are facing. We look forward to working collaboratively in the future to identify strategies on how to move forward with phase 3 of the CCPS compensation study. As you're aware, our compensation statistics indicate the need for ongoing salary scale adjustments to become regionally competitive. While we understand implementation of phase 3 may not be attainable during the fiscal year 21, CCPS believes it's important to provide a step increase to our employees to remain current with credit for years of experience earned in Caroline. The inability to provide a step increase would not only negatively impact the progress that has been made in phase 1 and 2, but generate compression, which has previously been addressed. Providing a step increase on the current scale costs the school division approximately $500,000. I would appreciate the board revisiting the proposed funding amount for the school division to reflect this step. Thank you for the opportunity to speak tonight.
Thank you, Mrs. Holt.
outnumbered.
Good evening, Chairman Sealy and Vice Chairman Thomas. My name is Dr. Jawanda Rollins-Fells from the Gratitude. This is the moment of gratitude for the safety and well-being of our students, staff, and families, as all of us are impacted by the COVID-19 pandemic and have had to make significant pivots to work with the necessary guidelines while continuing to provide services and resources to our community. I want to publicly thank all of our community frontline workers, businesses, county employees, and school staff who are continuing to serve daily. My second point is attentive and intentional planning. As a school board, we adopted our needs-based budget that aligns with our strategic plan. Our school administration has been staying abreast of the economic impacts that this pandemic is having on the school division while continuously monitoring revenue streams and expenditures and making adjustments accordingly. Tonight, you have heard from Dr. Calveric, you've heard from Ms. Deborah Holt, and you will be hearing from Dr. Monroe, who have all outlined needs. I thank you in advance for your consideration of these items, and it brings me to my third and final point, continued collaboration. It is imperative that Caroline County School Board and the Caroline County Board of Supervisors continue to work together as we have to date. As such, I have requested a 2-1-2 meeting the first week of June. It is imperative that we discuss information that has changed drastically since the budget was previously presented to you on February 11th, and to discuss how this pandemic has impacted the school vision currently and will continue to impact as society continues to define the new normal. I ask that you, Chairman Sealy, would confirm the 2 dates previously submitted and what will work for you and your schedule so that we can have our 2-1-2 meeting. Thank you for your time this evening. It is my sincere prayer for continued health and safety for our community, wisdom and insight for our leaders, and provision to be able to implement what we need to do for our community as a whole. Thank you for your time this evening.
Thank you, Mrs. Fells.
Good evening, Chairman Sealy, Mr. Cully, and all members of the Caroline County Board of Supervisors. My name is Dr. Herbert T. Monroe III, and I serve as the Assistant Superintendent for Caroline County Public Schools. This evening, I come before you, the board, to share that Caroline High School is in great need of an additional English teacher for the 2020-2021 school year. I ask tonight, what really makes for an impactful education under our COVID-19 normal? Is it the expensive science equipment, the size of a school's library, or is it new sports uniforms? As a father of 4 daughters and a 1-year-old grandson, I would argue that while these things are important, they are not the most important right now. I would offer that what is most important right now is who teaches our children and grandchildren, and that they are learning in an environment where the teacher-student ratio is one where the teacher not only has the time to teach concepts and skills, but one where he or she is able to connect with each student, both socially and emotionally, especially under our current COVID-19 pandemic. Currently, the average class size for English at CHS is 26.1 students, with several classes over 30 students. The enrollment for this fall is projected to increase from 1,168 students to 1,209 students for the 2020-2021 school year. In order for the Cavalier Nation English Department to remain in compliance with the standards of quality for English, class size should not exceed 25 students per class or section. This is just one of many reasons why it is essential for the Board of Supervisors to honor the request and to add an additional full-time teaching position in the area of English at Caroline High School. We, the instructional leaders, teachers, students, and staff of CCPS recognize, as we all do, that the world is an incredibly different place than it was when our school board approved the CCPS FY21 budget. However, whether students are learning to read on the elementary level or reading to learn on the secondary level, all students and teachers deserve an environment where one-on-one attention from the teacher can be given both in person and virtually. Students get to know each other and their teachers on multiple levels in class and or on a plethora of online educational platforms, or where teachers can tailor instruction more individually to meet the needs of all learners, especially now with our distant learning challenges. The appropriate student-teacher ratio will simply allow for more time to ensure quality instruction and student achievement. So please, we ask you, the Caroline County Board of Supervisors, to put the needs of our students first by making the full-time English position at Caroline High School a critical need for the FY 2020-2021 budget. Be safe, stay healthy, and thank you for your time and listening this evening.
Thank you, Dr. Monroe. We have 3 additional written for the record, and I have, if Mrs. Long would go ahead and read, we actually have 3 written, and 3 board members, different board members are going to read those into the record.
There we go. Now I can
Light
see.
does help.
That's it. All right.
Into the mic. Thank you.
Good evening, board members. I am a teacher at Madison Elementary School and have worked for the division for almost 27 years. As a resident of Caroline County, it was important to me that I work within the county where my children would be educated and where I am a stakeholder. The county is a great place to work, and I have been very happy here. I have never considered leaving Caroline County until this last year. As I watch other teachers come, get some experience, and become excellent teachers, and then leave, I am saddened to know that our students will lose yet another quality educator. We simply cannot compete with other area divisions. While I understand that Caroline County is not at the same economic level as Hanover, Spotsylvania, or Stafford, I do know that we are growing economically. I also know that cost of living in Caroline are rising. Unfortunately, my salary is not growing to meet those increases. With the COVID-19 pandemic, there have been other burdens placed on the school system, and those will likely be increased in the fall. Many of these tasks will be placed on the shoulders of already overburdened teachers as we attempt to educate our county's children. While I am told to be thankful that there was not a budget cut, I know that my paycheck will be cut. With the 2021 flat-funded budget and the increases in insurance costs, I will bring home less next year each month. Please consider a revision in the allotment for our students, our teachers, and our county's future. We work hard to ensure that the future citizens of Caroline are prepared to continue their education, serve in the military, or seek employment upon graduation. We cannot continue to do so without additional funding. Thank you for your time and consideration. Tamara Fagans, fifth grade teacher, Madison Elementary. Go Mustangs.
Mr. Forehand?
I have a letter from Mr. Stephen Jordan addressed to Mr. Floyd Thomas for reading at the meeting. I hope that the firehouse remains a top priority for the county and the Board of Supervisors. As a resident of the Belmont, of the Belmont community at Communicable Church neighborhood, I've been looking forward to it being built since moving here in early 2018. I hear the same sentiments from many neighbors, and I think the HOA president has also expressed the neighborhood's support of building the Communicable Church firehouse to you. This firehouse will have a direct impact on the neighborhood and the surrounding area in the county. Currently, the closest fire station is at Ladysmith. Therefore, everyone in my neighborhood pays a higher insurance premium on their homeowner's policy because of the distance. More importantly, though, is that when a neighbor needs assistance, help, it would be much closer by. The county has made investments in other county infrastructure projects in the schools over the past year, and now is time to make an investment in the safety of the county residents. I know the coming months create some uncertainty when it comes to revenue, but this project should not be put on hold again. It should proceed as planned. Thank you, Mr. Stephen Jordan.
And Mr. Black?
I actually have two, Mr. Seeley. I have one from another, but I will read the first one. This is one from the Caroline Education Association. Caroline Education Association statement to the Caroline County Board of Supervisors public budget hearing, May 26, 2020. Good evening, Chairman Seeley and Caroline County Supervisors. Thank you for providing this time for citizens to give input on the proposed fiscal year 2021 budget. I am not a resident of Caroline, but as an incoming president of the Caroline Education Association, I do represent a major Caroline County stakeholder group. I would much rather introduce myself and present this statement face-to-face, but I am grateful for the opportunity to participate remotely, given the risks that are coming in person pose. My name is Dr. Rachel Levy, and I am one of the U.S. Virginia government, I am a U.S. government teacher at Caroline High School. While I am not a resident of Caroline, I am very familiar with the Board of Supervisors and your names, since my curriculum includes teaching my students about their local government and about the importance of being actively engaged in matters of local governance. I might even have invited you to visit my classroom as guest speakers during May had our school buildings not been closed. Perhaps next year, and perhaps we might have arrange a virtual visit instead. Back to the matter at hand. On behalf of the Caroline Education Association, I would like to express my support for the proposed 2021 budget. Given the financial hardships and the revisions to the state budget brought by the COVID-19 pandemic, we feel that a $0 increase of the Caroline Transfer to Schools operational and CIP budgets represents a best-case scenario for local education funding. Otherwise, first of all, we are encouraged by your discussion of expansion of broadband access at your last meeting. Our students need that access in these times more than ever. Next is my understanding that CCPS is to receive approximately $750,000 in CARES Act funding. I imagine that much, if not all of this, will be needed just to make up for the loss of state revenues, including the loss of the lottery funding, at least until the end of June. It is also my understanding that the county, as a locality, will receive some amount of CARES Act funding. The CEA hopes that you will allocate the maximum amount possible of that funding to our schools. Public schools are community institutions that families depend upon a great deal for a multitude of services, especially during times of crisis and especially in rural communities like Caroline County. The central role that Caroline Public Schools serve in the community has become increasingly evident. Thank you so much for your time, consideration, and your service. And I have a second one. This gentleman, his name is Douglas Butler. He's from Lake Landor. I'm just going to briefly summarize. He had sent to me this a while ago. He had two concerns. The first concern, he feels that volunteering for our fire and EMS in Caroline is too difficult. And the second concern he had is our personal property taxes are too high. So thank you.
Thank you, Mr. Black. I am now going to close the public hearing on the county. I didn't have one. I'm going to close the 2021 public hearing on the budget. Comments from board members. Mr. Forehand?
Don't have any comments?
Mr. Black?
None.
Mr. Underwood?
I'm sorry, I was muted.
I understand.
My only comment again is that we are not sure of the impact of the budget. And I think as board members, we have to be responsible, not only for this year, as I said, the upcoming 2021 school year, but 21-22. So I appreciate all that we've done. We haven't, like I said, we haven't furloughed anyone as many other areas have. And yet we continue to work with what is presented to us from the governor's office. So I know that we're going to do all that we can to ensure that we're fair with all of the departments, and we look forward to certainly working with all the departments. That's my only comment, Mr. Chairman. Thank you.
Thank you, Mr. Underwood. Mrs. Long, comment?
I don't have a comment. I have a request, Mr. Cully. Mr. Cully, could you get a copy of the comments from the 3 speakers tonight so we have the figures and the request mentioned and send them out? Thank you.
Mr. Thomas?
I did have a question on the information that Mr. Cully sent us regarding the budget. I'm just trying to double check. It looks like the school's got $1.6 million more from the state. And I'm wondering if that's the revised figure or that figure has to be revised down. I saw him there. I don't know if he can answer that question, but that's all I had.
That was the latest figure that I had received from Marcia Stevens, the figures that are in what I sent out. So what we had in May, the May 5th, I updated for the latest spreadsheet that y'all have with her latest numbers. I expect those may go down again in July, wouldn't shock me. But keep in mind that 1 million it's earmarked all over the place for various things. A big chunk of it's some new initiative. How much was that, Mrs. Long? 800, 900, yeah, there's 900,000, some big initiative. So it's not, I don't know that they are receiving, I mean, budget year to budget year, total to total, they're up 1,078,000, I think, off the top of my head, but it's not like it can be used for anything, and it's what they're experiencing with the lottery. They are holding that lottery money now. 30% of the lottery proceeds got to go to capital, which it didn't used to. So anyway, I hope that helps answer your question.
All right, it kind of does. It's 28.7 to 28.3, so it's 1.6, just about 1.6. Now we also have COVID funding that's going to go directly to schools and some that's going to go to the county and then to schools. That's also correct, right?
They've got money coming straight to them, COVID money. We've got money coming to us, which we'll bring to you on the June 9th meeting with, some recommendations of what to do with. And that's good through December 31st. So if you sort of spend it all in July and need some in the fall or later, it may be gone. So we're trying to put together a plan, which then y'all can approve in June, hopefully.
Okay, last thing, if you can get that number and also what purposes that money can be used for, because we don't want to spend some of that money for a purpose that is not approved, and then we have to actually make that money back some other way.
No, that's what we've been working on, is trying to work our way through the guidelines of what we can and can't do with the funds.
Thank you.
Thank you, Mr. Thomas. As I stated in my opening board comments, my real goal is to try to keep everything that we have in this year's budget and maintain next year. And I think for any locality in the situation that everybody's in with what's happened to local funds that the average person doesn't necessarily realize. They don't, when you look at sales tax, when you look at meals tax, when you look at personal property tax, all those things roll up into our budget, and we're seeing impacts on all of those. So as I said earlier, my goal is to keep our situation in Caroline. If we replicate it next year exactly the same, I think we've actually come out ahead. I do understand there is some state funding for schools. I mean, federal funding coming for schools. And I don't think we're going to know the true impact of that until July sometime, because the rules and what you can spend it on are not going to be clear, and they're still changing. I have talked to Mr. Culley multiple times. I've talked to other board members in other localities, and they're all facing the same thing. What are we going to be able to spend the funds on and not be asked to return what we spent on because it wasn't approved? So I think it's going to be into July before we know what we can actually spend funds on and what we can actually allocate them to. So I'm just trying to get to the end of this fiscal year, June 30, and see where we're at, see where all the departments come in at. Again, those will all be one-time funds at the end of the year. It's not like we can reallocate those, but we can actually hold those in reserve for anything else that might pop up that wasn't expected, because we didn't expect COVID-19 and it came, and there's no telling what can happen to us after the end of the year and what pops up and we may need to replace, buy, or use for something else that we didn't anticipate. So as a board, I know we're all thinking about those things. I've talked to every one of you individually about it, and I think we're all looking at this in a very focused way. How do we maintain what we have? So those are my comments on the budget hearing. Before I forget, I want to, for all those that don't know, today is Mr. Brian Farmer's birthday. He has been at every meeting doing Facebook Live for us. He was on the courthouse lawn helping doing the Memorial Day celebration. I just want to thank him and say happy birthday from the board. And sorry you had to be here tonight on your birthday, but we do appreciate it. Closing board comments. Mr. Culley?
We did send out, Friday, Alan sent out our draft June 1st opening plan. I wondered if anybody had any heartburn with that. That's what we plan on putting in place. We've been trying to gather supplies and cleaning supplies, and it's been through a committee, and then it went to all the department heads for their feedback. And I think everybody basically is, every department's on board with it. So
I've read it. The only question I had was, do we have the clear petitions up in the public interface location? All of them?
we were well. I don't think there's any left of, but Mr. Sheila may can answer that. But I think even courts, we finally got them up, don't we? Right, but that one's not opening back up yet on June 1st. So that library's not, because that's a lot different space to try to figure out what we're going to have to do, like a food line where you just do a
right where you check out.
Right where you check out. But in that we're going to go to curbside on that, won't have any inside traffic. We felt it gave us some more time to figure out what we're going to do in the libraries. But all treasurer, commissioner, planning, courts, Mr. Sheeble's office, anywhere the public might interface, we have protection. So
have you seen Lynn's Gourmet lately? It's the most thorough and
I haven't. I'll have to.
You have to go about it just for a reference point. It's something to see.
I just have a question for Charles.
Go ahead, Mrs. Long.
The one department I've gotten the most questions on when will we have access to is DMV. Have we heard anything from them?
DMV would love for us to open up. We have real concerns with the size of our building and trying to keep social distance. If open up DMV way ahead of main DMVs getting fully operational, the backlog of people wanting to flock to DMV. We already deal with a lot of people that aren't county residents at our DMV anyway. So we don't want to be one of the first ones to open a DMV select. And so we've pushed that back. We just don't feel like we could. We were initially opening up appointment only, and so for DMV, we feel like that's a ways off, maybe phase 2, when you can have a whole lot more people near each other or something. But if you got to keep 6 people, we line up now to the elevator sometimes out at the DMV desk. And then think of this, they all go into the treasurer's office, and sometimes coming back, they do this parade down on the first floor. And so with tax paying season and other things, we just didn't feel it was,
Don't have 12 feet there.
we just felt like it was more important to us to try to collect taxes than it was to run DMV at this juncture, so.
Well, I do know the DMV in South Point is one of the 10 that they opened up in the state, but it is by appointment only. So just call and sit online forever.
Mr. Black?
Mr. Cully, if we could, and I know we got an update, I think there's a lot of people out there with our Parks and Rec department as summer's going on. It's people have been pent up, and I understand we want to be safe, but we need to have some stuff for our kids to do during the summer before they go back to school. So if you could talk to Mr. Howard about anything that we can think of, especially outdoor activities, it would be greatly appreciated. And I think the parents would greatly appreciate it as well. The second thing is, you know, as a member of VACO, over the last couple of weeks, the governor was having weekly calls with the members of the VACO staff and board of directors, and it happened for 2 weeks, and we were supposed to have it weekly. It has not happened in last week, and there's been no plan for it to happen this week. So I don't understand where those meetings by phone went. There was very few questions that were able to be asked in those phone calls. But my question to you is the money that has, the one thing that was baffling to most all localities was the money that was to be allocated to Caroline that was coming from the federal government. The deal was, hey, here you have it, there's no rules, but don't spend it the wrong way. Has that to be on COVID related expenses? But has that kind of been, have you gotten any more guidance from because what we were hearing on the phone was, here's your money, spend it on COVID related expenses, but don't do anything foolish with it. And then there was no guidelines. So have you guys received any guidelines from the governor's office in regards to, okay, you can spend it on this, you can't spend it on this? Because there was a lot of localities that were very confused by, all right, what can we spend it on?
I think some of that confusion still exists. We've been following some VDM guidelines for what's eligible for COVID-related expenses. I know there's some jurisdictions that are taking some of the guidelines a lot further and what they're planning to do with the money that we're not comfortable with. So as a region, we've been talking about it on our conference calls, and I have another one tomorrow to try to nail down some of that. And that's why we're all trying to put these plans together to bring to you in June on what we think we can do with it based on what guidance we have right now. But there's not a lot of real great guidance out there.
And do we have any, we know what money we're getting, right? Is there? Yes. So if with that money we're getting, do we know how much we're supposed to give to, because we're responsible for distributing the money to Bowling Green and Port Royal. So do we have a formula?
We don't. It would be based on population. I would assume the same formula they use for us, but we're also responsible for what we give to them that is spent right. So I think they're going to have to come up with what they want to do with it before they're going to get it.
Therein lies
our
frustration.
in all that.
Because if they mess it up, we're paying it back.
Yes.
And I think that's why we're going to be into July with all these funds that are coming COVID related. Everybody wants to talk about it and spend it. And we are in no position yet, and there's not been enough guidance. And until there's more questions asked and there's some additional
I think that
guidance given, I think we're going to be into July knowing that.
I think that should be a priority though, is finding out what we can actually spend it on. Because
we know we've spent for COVID related cleaning and things that we've bought for already currently, and that was being submitted to VDM. But now this CARES funding came along and they said, all right, that's where you got to get it from now. So we know we've already spent some of it for eligible things because they were all COVID related. So we're going to use those expenditures as receipts against and reimburse the general fund for those expenses we've already made. And the chief could tell me, he's the one that keeps up with that, but it's over $100,000 that we've spent so far, you know, with sanitizing stations and all the various cleanings and hiring.
Right.
Mr. Cully and I had several conversations because that was my concern with some other calls that I was on about what we could spend the money on. And it is a murky situation at best, and I don't want to owe any money.
Yeah, it goes along with Mr. Forehand's. It goes along with Mr. Forehand's concern, though, about the whole mask thing. Who's going to enforce it? How does the health department enforce it? It's like, how do you give someone money and say, here, do it wisely, and if you don't, then we're gonna not give you the money, not give you as much money next year, and we don't want to spend it incorrectly. And there was a lot of localities that had questions, and they weren't really addressed.
Mr. Thomas, did I hear you say something?
That's Mr. Underwood, I'm sorry. I just want to make sure, Mr. Cully, so the monies that, from what I've been reading, it's not meant to supplant revenue. It's meant to defray costs based on the virus. Is that correct?
That is correct. It's not to cover lost revenue.
Right. So that's what we have to think about as we look at it. It's not a supplant of revenue. It's to ensure that they help us with some of the costs as a result of the virus.
Now, on that note, though, one of the expenditures that was supposed to be allowed was to let you use it to help the schools expand their distance learning. So if we had some distance learning things, we could do that.
That is correct.
And they also have funds that actually are supposed to be used for capital projects like that have now been identified. So the real goal, as we figure out, and again, all of this is still not coming into focus, and I think it's going to take a little time, and it's going to take the county administrators working through some of this and asking different questions of different entities to get answers. It's not going to be a quick process.
The money came before all the guidelines.
Yeah. Right. And they're still writing them. So we won't see those. My guess is it's at least another 30 to 45 days before we get the guidelines. Any other, and I guess we're sort of in Mr. Culley's.
Well, closing board comments, Mr. Seeley?
Correct, Mr. Thomas.
Can I do just a couple real quick and
Sure.
I'm done? We spoke about the Memorial Day program, and I neglected to thank Mr. Donnell Howard, Reverend Donnell Howard, who came and did the invocation just because I asked him to do. And I also wanted to thank Mr. Schiebel, who has the wonderful can-do attitude, who made things happen as far as the sound equipment there. So I did want to thank those two personally, make sure they knew. And on the other note, the board talked about funding departments quarterly before, and then we decided to do a report. I'm going to ask again with the unknowns in our revenue stream. Maybe we want to fund all the departments at least half of the year before we go through the whole thing. And that's it.
All right, thank you, Mr. Thomas. Any other closing board comments? Hearing none, I'll take a motion to adjourn.
So moved.
I have a motion. Do I have a second? A motion and a second. Any further discussion? All in favor signify by saying aye. Aye. Opposed? Motion carries. Meeting is adjourned.